Hi, I'm Parija. Thanks so much for joining me here today. On this video, I want to share with you some results of a research study that I just recently came across about pre-eclampsia. Now, if you know anything about pre-eclampsia, it is a pretty scary health complication for mom and for baby during a pregnancy. So anything that we can do to reduce the risk of women developing preeclampsia is amazing. So that's what makes this study so interesting and so awesome. What they found was that when women increase their levels of physical activity during pregnancy, they actually reduce their risk of developing preeclampsia. When they increase the time that they spent doing physical activity, that also reduced their risk of preeclampsia. And women who sat more and weren't as physically active actually increased their risk of developing preeclampsia. Now, why this is so amazing and so important for us to know is that something as scary and potentially dangerous as preeclampsia is, there are things you can do to protect yourself and your baby before it even gets there. So, if you are pregnant and you're allowed to be physically active, go out and do it. Take a walk around the block, park a little farther away, and when you have to walk into a store, take the stairs when you have to go inside a building. I know during pregnancy, especially the further along you get, it can get really uncomfortable and there are lots of aches and pains and you just don't necessarily feel that great. But think of how much you are protecting you and your baby by taking those few extra steps. If you are on bed rest or you're not allowed to do some physical activity, don't worry, because there are still plenty of things that you can do to lower your risk of preeclampsia, even if you are stuck on the couch or on hospital bed rest. If you found this as interesting as I did, you may want to know a little bit more about what you specifically can do. So if you'd like personal tips and strategies on how to lower your risk of additional pregnancy complications like preeclampsia, then click the link at the end of this video and schedule a completely free 20-minute phone call, and I'm happy to share with you strategies that are going to be personalized to your specific pregnancy situation. I know that pregnancy can feel like a long, long road some days, and especially if you have complications, it can feel really, really hard. Just take it one day, one step at a time. You can do this. I can't wait to speak with you.